So today I'm going to be talking about the Quervain Tenosynovitis. I'm Andrew Gaylor. So today we're going to define what the Quervain is, review relevant anatomy, identify pathomechanics of the skin condition, identify clinical manifestation and functional limitations, identify appropriate tests and measures for diagnosis, differentiate between similar pathologies, describe the rehab process, and review expected outcomes. The definition is characterized as progressive tenosynovitis, which is just progressive inflammation of the tendon and the sheath. And this affects specifically the first dorsal component of the wrist and caused by repetitive thumb wrist motions leading to pain and swelling and limited motion. Okay, so some anatomy right here, the adductor pollicis longus, which is right here, and the extensor pollicis brevis are the two tendons that are involved with this. And then these tendons run through the first dorsal compartment, and the tendon sheaths in this area become inflamed, thickened, which causes restricted motion. So pathomechanics, this is caused by repetitive thumb and wrist motions, and this is commonly associated with occupations such as painting, mechanics, gardeners, construction workers, hobbies such as sports. Health conditions make it more susceptible, such as arthritis and getting directly hit on the thumb. Some clinical manifestations would be signs such as localized swelling and tenderness, crepitus, palpable thickening, loss of adduction of the CMC, and weakness in the hand. Some symptoms would include it'll be described as a burning, pulling sensation. Patients may complain of a creep, and there will be pain within the anatomical snuff box and numbness in the wrist or thumb. Some functional limitations would be texting, using an eating utensil, inability to turn a doorknob, carrying heavy bags, inability to participate in certain sports, and writing. And then some tests and measures would be palpation around the anatomical snuff box of the adductor pollicis longus and the extensor pollicis brevis, passive range of motion, active range of motion of the wrist and thumb, and then the Finkelstein test, which is where the patient folds their thumb in and then you passively ulnar deviate, and if there's pain along the thumb, that's a positive indication. Differential diagnosis. So we got arthritis of the first carpometacarpal joint, which will just cause a seminal like pain pattern. Scaphoid fracture non-union. A differential thing for that would be like a different kind of quality of pain, like a dull kind of pain would be for the fracture, whereas the Quervain is more of a burning or pulling sensation. Radiocarpal arthritis, while this like can cause you to be more susceptible, it's kind of a different little pain pattern. Then Wartenberg syndrome, which is just compression of the superficial radial nerve, which kind of can present the same. Intersection syndrome, which will cause pain with wrist extension and flexion, whereas the Quervain is more of a radial deviation, ulnar deviation. Some rehab process, some goals would be patient education, which would avoid aggravating factors, rest involved joints and tendons by either doing modalities such as ice or just splint. Maintaining tendon mobility with gentle movements, multi-angle isometric, pain-free range of motion, and pain management. The controlled motion phase, stretch and mobility in the pain-free ranges, dynamic exercises with pain-free range of motion, and then patient education on biomechanical corrections to avoid stress on the tendons. And then the return to function phase, which you'll progress to functional strengthening, endurance training, continue patient education on preventing re-injury, and develop a home exercise plan. Some of the expected outcomes would be recovery for about 4 to 6 weeks, decreased pain and inflammation, increased thumb, wrist range of motion, increased grip strength and ability to perform daily activities. And if none of this is successful with the conservative treatment, it may require surgery. For my overview, we got the Quervain is characterized as progressive tenosynovitis, results from overuse of thumb and wrist overuse, and may worsen with activities that require wrist grasping and gripping, requires a number of tests and measure palpation, range of motion, fecal sign tests, and initial treatment is conservative, and also may require surgery. There's my references.